Hey guys, Colton here at Preferred Physical Therapy, where we help those 40 and above stay active and independent, live free from painkillers, and avoid surgery. So the hip has a complicated history and is usually overlooked because we typically find a lot of people with back pain that stems from being from the hip being too weak, or the hip pain that actually comes from the back, or we have this chronic rolling of the ankles, which stems from weak glutes and weak hips. And we want to thank Stephen Curry for bringing this one to the big stage. So the hip is part of the body that bears most of the weight of the human body, and it's located between all these layers of muscle and ligaments, and they're all these muscles and ligaments are actually really strong. The strongest ligament is the iliofemoral ligament, which is on the front of the hip. So a healthy hip carries about 5 times a person's body weight when walking. And when we're more active, like such as running, it even carries more weight because, again, physics. So the hip is a ball and socket type joint, and where this ball and socket, right? So we've got our ball and we've got the socket, and it goes in through here. So with those kind of joints, we have a lot of mobility of where it can go. The femur, right, which is that leg bone, fits perfectly inside this rounded shape, which is the pelvis, okay? And then all those muscles and ligaments hang around that structure, and that creates that joint. So on that inside of that pelvis is called the acetabulum, which is has like a cushion cartilage on top of it, which allows less friction. But even more so, we also have the synovial fluid that is created from the joint, from these synovial, from the synovial membrane, that even reduces that friction, so that way we can move and walk and run without a lot of hiccups and without glitches. Luckily, the hip has so many structures, and so many muscles to help with supporting the hip and to help strengthen the hip, so that way we are able to go up and down stairs, walk, run, squat, sit down into chairs, get up from chairs. But a lot of the times we do need to be able to stretch the hip, because of those structures do get tight. And if we do have too tight of structures into the hip, we're unable to get it up and down of a chair easier. Because of the tightness, we can't go up and down stairs as easily, and it's difficult to get into and out of cars. And so really trying to stretch these things out is really important, and keeping our overall health. Sometimes though, we have this great mobility in our hips, however we're really weak. And so we actually really do have to find a good balance between the two, because if our hips are weak, we can have problems with rolling our ankles, back pain, and we have this abnormal gait pattern because of it. And so doing any hip strengthening, hip mobility is going to be hugely impactful and beneficial for all the joints above and below, such as the knee joint, the ankles, the back. Any sort of that is going to help us improve those, as well as our hips, even if it is just true hip pain. If you guys have any questions, please check out our blog, check out our other Technique Tuesday videos for some hip exercises to help strengthen or stretch out the hips. And if you guys do have some hip pain and want to get it checked out, come see us for a free discovery visit, and hope to guys see you soon.